Okay, so when I looked a little bit more at the shaving that I'd done, I decided I needed to do a little bit more to clean up the edges. So if you look a little bit closer, you'll see, I think that looks better. I was able to get a bigger surface area cleaned out, and here are my shavings over here. Okay, and I decided I shouldn't go any deeper because I didn't want to get into the viable tissue. Okay, so I'm ready to move on to the cross-hatching or scoring. I've got my number 15 scalpel. I'm going to hold it like a pencil. I'm going to get it nice and tight down in my web space. I'm going to hold it in the serrations, not on the blade. I'm going to cut with the curved portion, not with the tip. I'm going to make some parallel and perpendicular cuts, trying not to get them too deep, not into the viable tissue. And I'm going to use this blue section. So I'm going to turn this a little bit so that hopefully you can see this a little bit better. All right, and so I'm going to start over on this edge with the curved edge. Come nice and straight down. Now, get myself positioned a little bit better with my forearms. Hold on, and now let's check out that cut. Let's zoom in a little bit, and you can see it's not down into the white tissue at all. It's still in blue tissue, so that's a good cut. All right, I'm going to go back. Get as close as you can. Okay, now I'm going to go back. And I'm going to do several more nice long cuts with the curved edge. Good. Check that one out. That one looks good as well. Not too deep. So if this was eschar, I would still be in the eschar and not on the viable tissue. So again, curved tissue. Curved blade into the tissue. Checking that out. That looks good. Got my forearms nice and positioned. Going again. Curved surface all the way down. Good. All of those are looking like really good cuts. All right. So now I'm going to turn and go in the other direction. If I had a patient, I would turn myself so that if they didn't have to move, I would just move. My forearms are stabilized. Curved surface of the blade is going down, all the way down. Good. Good. Doesn't look too deep. I'll make a few more cuts and then try to zoom in so that you can see it. Good. Good. Staying in the curved part of the blade. Staying away from that tip. Good. Alright, so now they look like good cuts. So can we zoom in as tight as you can? Good. And it's not down into the white tissue. It's still in the light blue tissue. So those look like good cuts as well. Good. Okay. Going to stop, regroup for the next section. Thanks. Okay, next we're going to do the debridement. So I've turned my ham hock upward so that I have my necrotic tissue here. Let's go over how I'm holding the instrument. So I have the forceps. I found that holding it in the palm worked better for me. So I've got it in the palm of my left hand, which is my non-dominant hand. I've got the scissors in my right hand, which is my dominant hand. I've got my fourth finger and my thumb with my index finger right there at the joint of the scissors, or right there at the shaft, in a 3-point fixation. I'm going to get my forearms really comfortably situated so that I don't have to move. I've got my paper towel ready to collect things. Things I'm going to remember, I'm going to pull up the tissue with my forceps. As I'm cutting, I'm going to try to stay a third to a half of the way up. I'm not going to cut with just the tip. And I'm going to keep the tip of the scissors always pointing up. So here we go. So I'm going to hold on to the tissue, pull it up, and I'm going to try to stay parallel to the wound bed and cut a little snip. Put it over here. It's all very blue. Okay. Slippery. All right. I think those were very good cuts. I'm going to keep working at this. Holding onto the tissue, lifting up. Good. I'm going to work on going a little bit deeper on those scissors as we go along here. So I'm going to lift up, get the scissors pointed up. Good. That one was better. Got a little more of the necrotic tissue out with that last cut. Let's see if I can do that again. Going a little bit deeper. Good. I know I wouldn't have this running conversation with my patient. I wouldn't want them to worry. Let me get these forceps back down in my hand. All right. Pointing up with my scissors. Good. That was more productive there. Good. Forearms are nice and anchored. Good. Good. Yeah. I'm trying to make sure I don't get too much tissue out at a time. I don't want to inadvertently get too deep. So I'm trying to work around the entire surface area here so that I get a little bit of the top layer off and get a better sense of how deep I need to go. And try to keep repositioning my forearms so that they're well supported and my instruments so that they're staying put in these gloved hands. Looking good right up here. I don't know if you can see that. That's looking really good. So I'm going to turn off the camera. I'm going to keep working and then I'll come back in a few minutes when I'm finished. Okay, so here we are 15 minutes later. I think I've gone about as deep as I think I should with this. I think if I go any deeper, I could potentially cause the patient some pain and I wouldn't want to do that. And after all, we would continue treating this wound with autolytic dressings or with mechanical dressings and mechanical type of cleaning, I mean, like a whirlpool or something like that. So I don't have to get every single bit. But I have gotten down to the lighter blue. And if you can look at what I've debrided from that tissue, I've tried to do it in small amounts so it's all well controlled. And just to review, I have held the forceps in my non-dominant hand, nice and stable with my with it in the palm of my hand. I've held the scissors with the fourth finger and the thumb and the finger right on the base of the scissors for a 3-point stabilization hold. And I've tried to stay within a third to a half of the depth of the scissors, keeping the finger, the pointed tip up the whole time. So this has been a very interesting lab. I do think I've learned quite a bit. Thank you very much. Have a nice holiday.